Imagine that you're about to devour a juicy steak, getting ready for a family photo, or having a great conversation with the girl or boy you've had a crush on. Then, oh snap! As you start to smile or chomp down on the food, your crush winces as he or she sees the teeth that you have neglected, or you feel pain in your teeth as you chew. What if I told you that these uncomfortable moments can be prevented by an extra few minutes of dental care every day? So, where do we start? I have a plan. I want to go through 4 points for you today. 4 points that will make you a master of dental hygiene. Ready? First, we'll cover the structure and function of the oral cavity and its parts. Then, we'll discuss what happens when you don't maintain your dental health. From here, it makes sense to talk about how to prevent such potential problems. And finally, we can chat about healthy diet and how that plays a pivotal role in dental hygiene. In this video, we'll talk about the first two parts. And in the next video, we'll talk about the last two. So first, let's talk about structure and function. Your mouth has many important parts besides from your teeth. But for the purposes of dental hygiene, let's discuss the three imperative parts. First, there's the gum. No, not gum like the one you're chewing right now, but it does look like bubble gum. It's pink and tender in texture, and it's a tissue that surrounds the bone to hold the teeth in place. It serves as a protective barrier as well as a support for the tooth. Healthy gums are firm and do not hurt when you brush or floss. Unhealthy gums are often swollen and less firm and can bleed, and if left untreated can lead to periodontitis, which we will discuss later. Now, let's talk about the teeth. We all are born with a set of teeth called baby teeth. After we are born, these teeth start to erupt and appear in our mouths, and when we get older, our baby teeth are replaced by stronger and more permanent teeth. Adults have 32 teeth, and the teeth come in various shapes and sizes. The shapes determine the function. For example, the molars in the back of our mouths are large and flat and used to grind food when chewing. The premolars are in front of their bigger molar neighbors and are transitional teeth between the canines and molars. The canines are narrow and sharp-looking. They are used to tear into and bite food. And the final part in the teeth that appears when you smile are your incisors. They are small and shovel-shaped and are often used to cut off pieces of food and to bite. As such, teeth are the first link in digestion, as they break up food before you even swallow. But more importantly, let's focus on the general structure of the tooth. The tooth is one of the hardest structures in the human body and is important in speech. The crown of each tooth is what we see in our mouths. The first layer is a shell-like enamel that protects the sensitive and soft portions of the teeth underneath. Beneath it is a dentine made of hard tissue, and beneath that is a softer pulp. Both are sensitive, but when an enamel is broken, the pulp is particularly sensitive to heat and cold, causing pain, because it contains the blood vessels and nerves connected to the root. Additional tissues and ligaments help hold the roots of the teeth to the jawbone and gums. Finally, there's the tongue. We won't discuss it too much here, but it's important for tasting, moving substances in our mouth, and swallowing. So, now you may ask, how can anything go wrong? Well, there are many things. First, there's plaque. If you don't clean out your teeth, plaque builds up, and it makes everything go downhill. Plaque is a film of bacteria that grows on surfaces in your mouth. It appears as a white or yellow layer often found between teeth. The bacteria in the teeth release acids and other chemicals that can cause infection and inflammation, leading to a number of problems, including gingivitis, periodontitis, and caries, also known as cavities. First, plaque can cause inflammation and stripping away of the gum, which, if allowed to build up, causes gingivitis, a very common disease that causes pain or bleeding. If the plaque is left untreated and continues to build up, then, over time, inflammation develops into gum disease, or periodontitis. At this point, the gum tissue is being pulled away, causing bacteria to build up in new pockets and cause an infection. Then, the gum can't provide the protective barrier and support it's supposed to provide. As such, periodontitis can cause lasting damage to your teeth and the bones that support them. And before you know it, you may be losing one of your permanent teeth, and that's not good. The plaque can then cause cavities, as the released acid creates visible holes in our teeth by damaging and destroying the tooth enamel. If the decay is left untreated, it will reach the tooth's pulp, contain the nerves and blood vessels, and then subsequently causing pain. At this point, the tooth is labeled a cavity. Oh, and one more thing, bad breath. Yes, that may be a product of the decay and bacteria caused by plaque, cavities, and gum disease all together. But not always. A strong possibility in most cases of bad breath, or scientifically termed halitosis, is due to the bacteria that produces toxins when decaying teeth or breaking down food. So, that ends this video on dental hygiene. Sorry for the depressing tidbits of information, but in our next video, we'll talk about positive things, including how to take care of your teeth and what things we can do in our lifestyle to make sure that we have a sparkling smile at the end of the day. Thank you.